And does Mommy Makeover mean the same thing to everyone?
That part.
That's a great question.
Ooh,
Yeah.
yes.
Because really it's just a catch-all term to describe a combination of procedures postpartum. So that the most common combination would be a breast procedure, whether that's an augmentation with a lift or what have you. And then some kind of body contouring procedure, which often the most extreme would be like a tummy tuck with lipoplasty. But someone might just need lipoplasty alone if they have good musculature. Or someone might need a mini tummy tuck, which is not as invasive or large as a full tummy tuck, but they may need a lot of like liposculpturing with the mini tummy tuck.
Welcome to Care Experts, a podcast dedicated to empowering you with knowledge for your health and self-care. I'm Melissa, a broadcast journalist.
And I'm Selah, a former fitness coach and personal trainer.
Each week, we interview top wellness and medical specialists from across the country, addressing your questions, even those you might be afraid to ask.
From your fur baby's well-being to skincare secrets to honest talk about bigger health issues, get it straight from the expert.
Join us every Wednesday for insights that will guide you on your health journey.
From cosmetic to dental and vet to vision, this is Care Experts.
So what we're talking about today
is
Mommy Makeover.
The coveted Mommy Makeover.
Is it coveted?
I mean, it's coveted by me.
Why?
Well, that's true. It depends on your situation.
Sure. I have one kid, and I don't feel like I need a mommy makeover.
I don't think you do.
Well, thank you.
Not at all.
But I am interested in knowing what does that actually entail, like a full mommy makeover.
Yeah,
you
what
hear
exactly
that term
is that?
all the time.
I know.
It's all over social media too,
yes,
right?
it's definitely in our lexicon now.
For sure.
Yes,
But why do you think you need one?
Well, I know I need one.
You have 3 boys.
I had 3 boys.
3 large boys.
11-pound boys.
Oh, honey,
yeah,
no.
I mean, come on. They destroyed my body. And I was one of those. I was a personal trainer, I was a fitness instructor. I'm like, anything could be fixed with exercise with the proper. I was even like a prenatal, postnatal certified trainer.
Oh, wow.
So I know what you can do. However,
there are limitations.
There are limitations. And I know now that these boys destroyed my abdominal section.
Oh.
So I need a tummy tuck. I have a hernia. I have 2 C-sections on me. I mean, the whole shebang. So I'm excited to hear. I'm excited to get my free consultation today. Come on.
Oh, let's do it. And you know what? It's not just a free consultation for you. It's a free-ish consultation for all of our listeners and our viewers.
Yes,
right?
who are interested in doing
Who are
this.
interested, either don't have the access to someone to ask these questions to, and we have the medical experts to ask, right?
That's right. And especially Dr. Q.
Dr. Suzanne Quardt.
She's amazing. I'm excited.
Dr. Q, as you said, as she likes to be called, right?
Yes, from Dr. 90210.
Yes, Dr. Q did her general surgery residency and plastic surgery residency, as well as research at the LA County USC Medical Center,
where she also served as chief resident in plastic surgery from 2003 to 2004.
And she completed a specialty postgraduate fellowship training program in complex plastic reconstructive surgery. Do you like how I enunciated that? Was that good?
That. Theater approved.
Thank you.
Yes.
So what we're saying is she's extremely qualified.
Extremely knowledgeable.
She is the medical expert to ask and have this conversation with, a candid conversation, if you will, right? Because I feel like a lot of people out there are too embarrassed to admit that they want a mommy makeover.
Exactly.
And we want to take that stigma away.
Yes, we do. I'm very excited to ask her our questions, my personal questions.
Yeah, get your free consultation.
Get my free consultation.
Exactly.
For that. Yes, and so here we go.
Let's bring in Dr.
Should
Q.
Dr. Q,
let's
here we
go.
Welcome back. We are here once again with the fabulous Dr. Q.
Dr.
Thank
Q.
you so much for being here again.
Oh, it's my pleasure. I just enjoy speaking with you ladies so much.
Oh, we love having you. We love having you. And then you decide, okay, I'm going to specialize in breast augmentations, liposuction, and then like mommy
Tummy
makeovers,
tucks.
tummy tucks, like all the
Mommy
things.
makeover.
Yeah. What
so
made you
cool.
go down that specific path?
Well, I did do a lot of reconstructive work coming right out of training, and also at USC we got excellent training on even microvascular reconstruction. But from that training, by treating like women with breast cancer and starting from nothing and building 2 beautiful breasts, after such a horrific diagnosis, and they're survivors, and that augmented my ability and eye towards cosmetic surgery, where they didn't necessarily have some pre-existing cancer diagnosis, but I really loved making people look and feel beautiful. I mean, I've always loved like before and afters and makeover shows.
Yeah,
and
who doesn't,
I grew up
right?
with Oprah,
Yeah.
and
Oh,
I used to
yeah.
be fascinated with all that stuff. So I think I just kind of got down that. In aesthetic surgery, we also operate on healthy people. So it's, it's just a different level. I mean, it's stressful, but it's a different level
It's not as
of
much
stress.
life and death. It's more,
Right,
yeah,
yeah.
that absolutely makes sense. And you're actually giving life in a different way,
Yeah.
especially to women and with the mommy makeover type of thing. You know, you're giving them a new life in a way
Well,
in
I
their body.
respect them so much that sort of what they're complaining about was caused by the most beautiful gift a woman could have is giving birth to a child.
Yes.
So why should they have to live forever with some consequences of that?
Yes.
That they didn't cause. I mean, it's just part of
Right.
the process. It's
Out
a
of your
beautiful
control.
thing, out of your control.
Exactly.
So if I can fix that, why not?
That's
What
amazing.
have you seen that do for a woman who comes to you and is like, I used to be this, I have this amazing kid, but now my confidence is here because no matter how hard I work out, nothing seems to be getting me to the place that I need to be at. Help. How have you seen that impact your patients?
Well, I love that because I've seen women who have developed hernias and muscle
That's me.
separations.
I have both.
So that's where we can surgically sew those muscles back together, those rectus muscles. If sometimes even the abdominal wall just gets, I mean, yours is severe to be separated, so we can repair that. Sometimes it just gets lax and thinned out, and so we can plicate, meaning sew it tighter.
Oh.
So
That's
I
so
feel
cool.
like when I educate them and they're feeling badly, but I say no amount of sit-ups or crunches
Yes.
or working out is going to fix this. They kind of relax and feel better
Yeah.
because they realize that it is something that surgery can fix and
Yeah.
then
Exactly.
and bring them back to like that pre-pregnancy body that they're used to having.
Sometimes medical intervention is the way to go.
Absolutely.
Because if you want your confidence restored, and it's not always just about vanity, when you feel better about yourself as a mom, you can be a better caregiver.
Like, I'm not trying to win a bikini contest anytime soon. I just want to look good in my jeans. You know what I mean? Like, I want to just feel good and confident.
Yeah, that part.
Exactly.
Well, I actually do operate on a lot of fitness competitors.
Okay.
But I tell all my everyday moms, like, I will get you in a bikini for summer.
Let's do
and then
this.
for their vacations. But for the gals that get up on stage, I have some other techniques, particularly with my breast
Right.
surgery, because, they're flexing their muscles and they
Yeah.
want their
Yes.
implants moving.
Oh,
when they-
gosh, yeah.
when they flex. So I'm very detail oriented for what a woman does
Right.
career wise and making sure the aesthetic that they're looking for matches. And then if I can't deliver something, I tell them why, or if I feel like I can do something a different way that's better for them, I'll suggest it and they'll be like, oh, great.
Oh,
stuff
that
like
brings a really good question to mind. What do you do when someone comes into your office and they're like, I want to look like Claudia Schiffer, and there's no way? How do you handle that as a surgeon?
I try to get the positive message out of it, meaning what are they expecting, and then I can inquire further, right?
Okay. So,
So
setting realistic expectations.
So it actually can be helpful.
Yes.
Because even, I mean, if the expectation is realistic and I say, okay, I can deliver A, B, and C because your anatomy is such, then great. But also I could say, you know what, I can't do this. I cannot deliver something because, and I say the reason why. So they'll say, oh, okay, I understand.
Right.
Because if you don't have that conversation pre-op and you deliver something that's not what they're expecting, they're not going to be happy.
Yes.
So I'd rather have that conversation up front. And, so I actually encourage, sometimes we'll call them wish pics, not to, I mean, I used to be hesitant to look at photographs or deliver photographs because I said I didn't want it to be a false warranty of anything.
Yes. Yeah.
But the reason that I like them now is because a picture can speak 1,000 words.
Yeah.
Sure.
Because sometimes someone will say, I don't want to be that big, but the photo they show, I'll say, well, that to me is a double D.
Right.
Or they'll say, meaning the picture will tell me more of what they're thinking.
Does mommy makeover mean the same thing to everyone?
That part.
That's a great question.
Ooh,
Yeah.
yes.
Because really it's just a catch-all term to describe a combination of procedures postpartum. So that
Okay.
the most common combination would be a breast procedure, whether that's an augmentation with a lift or what have you.
Okay.
And then some kind of body contouring procedure, which often the most extreme would be like a tummy tuck with lipoplasty.
Okay.
But someone might just need lipoplasty alone if they have good musculature,
Oh,
or someone might need a mini tummy tuck, which is not as invasive or
Okay.
large as a full tummy tuck, but they may need a lot of like liposculpturing with the mini tummy tuck.
Wait, do people come in knowing some of these terms? Like, I know tummy tuck is like a colloquialism now. Like, we all say tummy tuck. I know that's not like the medical name for it, but do people come in saying, I want a micro tummy tuck, or I want like the full thing? Or
Some people are savvy because they've either been on other consults or looked at a lot of websites and have actually the verbiage down.
really?
Yeah.
Oh, wow.
And then some others not so much.
Right.
And so we just roll with what they know, you know. I encourage education. So the more they
Yeah.
research something, I find it fun because then you can really set expectations and
Exactly.
they know the language kind of and you can say, or have you heard of this? And maybe it's something new that they haven't heard of or considered. And I will say, and that's why I think this is better for you.
Specifically for
Specifically
you.
So
yeah.
you do customize to the
I love
patient.
that. I love
no
that.
two moms are the same. Never.
That is so
Right.
important
no,
to say
no
that.
two bodies. There's the
No two pregnancies are the same.
Right.
My
Even in the same
individuality
body.
and everything. Yeah. Well, and actually, I was going to ask you with the tummy tuck, is it important to lose as much weight as you can? I've heard of people doing Ozempic so that they can get a tummy tuck. Does that? Because I don't know how true this is, but when I was a personal trainer, I noticed people who got liposuction and tummy tucks, if they didn't correct their eating or their diet, the fat would just deposit in other places. Is that true?
So that's actually a myth.
Yes.
So we're all born with a set number of fat cells.
Okay.
Okay.
So once you remove those fat cells, whether it's through liposuction or you cut it out directly, they're gone for good. So that's why lipo, even though it hasn't changed much over the years because it's so effective.
That's awesome. Yeah.
So what happens is, let's say I lipo a mommy's tummy, but they gain 20 pounds for whatever reason.
Right.
Their tummy will be relatively flat. It might just puff a little, but you know, their arms might swell because what happens is the existing fat cells then expand.
That's what I meant. Like, does it go to the fat?
So they'll
It's
say,
like,
so it went here, and I'll
Yes.
say, no, if you just lose that 20 pounds, you'll look just like you did.
yeah.
So it doesn't travel somewhere
No,
else. It's
but
just a
it, like,
disproportion.
whatever fat
Because
cells are
if you
available.
already
Still
have
there.
this
Yeah.
much and then it swells, it's
Oh.
going to look
Exactly.
disproportionate to the areas that had like.
That's what I meant. So do people prepare for that by doing, trying to lose as much weight as possible, or?
So I always educate that the closer you get to your goal weight before surgery, the better your results will be.
Okay.
Because imagine for a tummy tuck, for instance, if they ideally want to lose 30 more pounds, not only will the outer fatty tissue be thicker, but the visceral fat, which is our protective fat that protects our organs and helps line and protect, that swells. So that's how men can get the beer gut tummy. And they'll say, oh, I need lipo. And sometimes they have very little subcutaneous fat, meaning
Yes,
you
this
pinch
under the
it and
skin.
it's just skin.
Yeah.
But their tummy is bulging because of the visceral fat. If you actually are protruding out because of big layer of visceral fat, it's harder for me to tighten those muscles on top. I can only get you so tight as your visceral fat layer will allow me.
I see.
But
Okay.
let's say you lost that weight, things go down, then I can sew you even
really
tighter.
get it tight. Yeah.
Yes, because everybody
Makes
wants
sense.
their tight tummy
Yeah.
as tight as
course.
possible.
Yes.
You know what I'm curious about? Realistic timeline. So you mentioned about getting a mom into like bikini shape. Like, I'll have you in bikini shape for summer. So what does that look like? Let's say I'm a mom and I want to have a breast augmentation or just a tiny lift, okay? Because I do. And that's actually really all that I want to have done. Let's say I come in January. I'm already in my good shape, but I come in January. At what point am I able to be like carefree and in a bikini?
That's a great
Is it
question.
months later? Is it like, what does that recovery and the timeline look like?
So basically, it depends on the area of surgery and then how many procedures you have at once.
Okay.
Okay.
So that's why a mommy makeover will require more time to recover because it'll be a breast and a body procedure.
Sure,
which is
sure,
so
sure.
many
Multiple
areas. So then you're
areas.
looking at months. Okay?
Months, okay.
But if you're just gonna have a breast augmentation with a lift, it depends on what kind of lift.
Okay.
Because there's a circumareolar lift, which is like just tightening up around the areola. Then there's the lollipop lift where the scar goes around the areola and down the front. And then there's a full anchor lift where it goes around the areola, down the front and underneath. And it's just because the scar looks like an anchor.
Oh, okay.
So all those incisions then need to heal, and then it takes a full year for a scar to mature, but you'll be able to, go out in a bikini prior.
Okay.
So I would say for procedures such as what you were describing, a month, and you could go on vacation,
Oh, wow.
yeah.
Okay, and I'm going to be
But
super...
a mommy makeover is going to be
But with a
much
tummy
longer,
tuck,
yeah.
would
Yeah.
that be like 2 months or 3 months?
2 to 3, and
Okay.
then the scars, will take even longer before. So we don't even offer a revisional surgery for a full year. And the reason isn't to make people wait a year.
I know.
The reason is it takes a full year for the tissues to settle, the scars to mature. So then after a year, it is what it is.
Okay.
So if we need to correct something, whether it's a scar, an asymmetry, you can
can't do it for a
You
year,
do it at a
At a
year.
year,
Most
okay.
plastic surgeons.
I've
Okay,
noticed
okay.
with my C-section scar,
I
my
know.
son is 5.5 years old, right? And so my C-section scar looks totally different
Uh-huh.
now than it did, of course, right after I had him, and then even a year after. I mean, it has
Exactly.
continued to look better
Better.
and better.
Yes.
My question, though, is as a Black woman, as a melanated person, any person who has like darker skin tones, if you are going to have any kinds of incisions, I don't get keloids, but for women who do, is that something that you are able to minimize?
So we do discuss that. Meaning,
Okay.
and so I'll ask, do you have any old scars I could see to see kind of how they form scars?
Sure.
The tricky part happens is keloids can happen in some areas of the body and not others. So that's another, yeah. So you have to think about that. People with more pigment can also develop just darker scarring.
Sure.
And that can even be annoying. And sometimes we can do some bleaching creams after, and sometimes it is what it is.
Yeah.
Because something that delivers heat, like a laser treatment, could actually make that worse rather than better.
Okay.
But on someone with a lighter skin tone such as yourself, I may be able to offer laser correction of a scar.
Bleach it out a little.
Yeah.
Yeah.
Or the numbing cream can be for both pigmented or non-pigmented.
Okay.
If it gets dark.
So,
Yeah.
Yeah.
So, but I do tell people the ideal timing. I'll ask my first question before tummy tuck is, are you done having kids?
yes.
Oh,
yeah.
yes, of course.
It has to be done. Well,
It
that
should be done.
That
Because-
actually brings me to a question about the C-section scar. I'm so glad because I have 2 C-sections.
Oh, wow, yeah.
Are you able, when you pull the tummy tuck, the skin? I've heard you pull the abdomen so tight. Are you able to pull it so that the scar goes away, that part of the skin, or how do you pull the skin around the scar? Basically, is my question.
So usually if you have enough laxity, we can get rid of that whole scar.
way.
And then it does depend on how
Yeah.
much laxity you have in the lower tummy.
Okay.
So for women who have what we call that like abdominal pannus or where they have an overhang. Well, the other thing that happens with a low scar such as a C-section scar is the fatty tissue above it can shelve over the scar because the scar becomes contracted and fixed. And so sometimes that can't be corrected, or you would have to do like a lipoplasty above it to flatten it out. But if we are able, we will completely cut out that scar and make it better. If you're very trim and you don't have, we can't do a full tummy tuck, then we can do something called a mini tummy tuck.
Okay.
And that's where we can still cut out the scar. It's not as long of a scar as in a full tummy tuck, and then do a lot of lipoplasty. But we can only then sew the lower muscles tight, not the upper.
There are so many women who have questions like the ones that we're asking you right now, and so many women are afraid to to talk about it because people are like, oh, you're just being vain, or
That's
oh, you're just.
so
It's like,
true.
no, it's not just being vain. Maybe there's a small component of vanity, but it's also like, I need this for me because I want to be the best mom I can be. You're a mom yourself. You have a daughter,
Yes.
right? I'm sure for you, it means a lot to have your daughter see you working hard, but also having
Helping
fun,
women,
helping other women,
you know,
like
giving women back their life, like you
yeah,
said,
giving them
like
their
this
confidence back.
before. I mean, this is. I don't even mind if I was 5 to 10 pounds heavier than before kids. Fine, whatever. But it's the fact that I have a protrusion and a shelf that is just
And-
like it's horrible. I can't
Yeah.
dress.
You have conditions that can only be fixed with surgery.
Exactly.
Medical
yeah. And I
intervention.
think, like Melissa said, there's so many other women like me. I can't even tell you the amount of questions I get asked. I'm like, I'm not a doctor. I'll send them your way.
Well, a lot of my patients have the mommy guilt.
Yes.
They feel like they shouldn't do something for themselves because they're so used to taking care of their family.
That part.
So I
true.
always remind them, I always say this has to be something you want to do. And then you have to give yourself also the time to recover from the procedure
that's
because
tricky.
everybody, is counting on mom.
I know.
And I always tease the husbands usually don't realize how much the moms do until they've had surgery and can't do it.
Yep. Listen, I have to hire 4 people when I come to work.
Yeah.
We do a lot. No, you're absolutely right. And what about post recovery as far as lifting other children? I'm sure that's a part of the equation.
So after a breast procedure, usually there's no lifting, heavy lifting for 2 weeks.
Okay.
And then beyond that, I guide them depending on how many how much breast procedure they had done. Meaning, is it a straight augmentation or did you do lifts with it, and what have you? So, obviously, if you're doing a full anchor lift, it's going to be a little longer. But I guide them through the healing, meaning I'm seeing them back in the beginning. It's twice a week and then every
Okay.
week until they're flying.
Oh, wow.
And then I like to take post-op photos at 3 months, 6 months, and a year. So it's a process.
Yeah.
Because the results can change from 3 months to 6 months to a year. And typically the progression is that it just gets better with time.
Well, that's all for now. This conversation was so good that we've had to put the rest in an additional episode.
Don't miss the exciting conclusion of our conversation in part 2 of this episode. Stay tuned.
Hey, stick around if you want to hear more about health and wellness in these episodes of Care Experts. Don't forget to like and subscribe.